At the end of June 2024, this study was published by the Harvard T.H. Chan School of Public Health, and I want to talk about the results of this study given the current sociopolitical climate, particularly focusing on banning gender-affirming care for gender-diverse youth in the United States. Much of the discussion around banning gender-affirming care for minors really focuses on banning gender-affirming surgery for minors. Now, I'm not going to deny that gender-affirming surgery occurs on minors because it does. However, the frequency at which it happens is extremely rare. However, despite the low frequency of gender-affirming surgery occurring on gender-diverse minors, the sociopolitical rhetoric around gender-affirming care tends to hyper-focus on surgery, making it sound like children and adolescents of all ages are receiving these surgeries at very high frequencies. So this study sought to answer that question. How frequently are gender-diverse adults and youth receiving gender-affirming surgery in the United States? They used a national data set and collected data from 2019. And this is what they found. The rate of undergoing a gender-affirming surgery with a transgender or gender-diverse related diagnosis was 5.3 per 100,000 total adults compared with 2.1 per 100,000 minors aged 15 to 17 years, 0.1 per 100,000 minors aged 13 to 14 years, and 0 procedures were done on minors aged 12 and under. What might even be more interesting, however, is that they then looked at the 151 breast reductions that were conducted on both cisgender males and individuals with a transgender or gender-related diagnosis, and found that among the 151 procedures that were done on minors, 146, which was 97% of them, were performed on cisgender male minors. You might be wondering why cisgender male minors are getting breast reduction surgeries. It could be for a reason like gynecomastia, where there is excess tissue in the breast. There is this unfortunate misconception out there that gender-affirming care is only for transgender and gender-diverse individuals, but the reality is that non-trans individuals also receive gender-affirming care, as evidenced by this study. However, when politicians try to propose or pass bills banning gender-affirming care for minors and some adults in some situations, they are never focusing on the cisgender individuals who are receiving gender-affirming care as well. So in conclusion, not only is gender-affirming surgery on minors extremely rare, among minors that do get gender-affirming surgery, the vast majority of those are cisgender individuals.